The following exercises will help prepare your shoulder and upper trunk for surgery. This can assist the surgery and help you recover faster. They're especially important if you've had previous shoulder, upper trunk pain or injury, such as frozen shoulder or rotator cuff tear, and if you've had a mastectomy or lymph node removal. Treatments such as radiotherapy and the natural aging process can also reduce the strength and flexibility of these muscles. There are different types of breast reconstruction. It's important to discuss with your surgeon how your reconstruction will affect your muscle strength and flexibility, and therefore what exercises are best for you. For example, if you've had an expander under your pectoral muscle, improvements in your strength and flexibility will take longer. You need to consult your surgeon before you do these or any other exercises after your surgery. They shouldn't cause pain in your shoulder, upper trunk or scars, or cause any pins and needles in your arms. They should be performed 3 times a week, either in a single session or separately throughout the day. The strength exercises should include as many repetitions as you can with no pain. If this is more than 15 repetitions, increase the resistance of the elastic band. Start with the weakest resistance and progress to stronger resistance bands. 10 to 15 reps equals 1 set of exercises. Do 3 sets and rest for around 3 minutes in between each set. Keep going until your muscles feel tired from working hard. The repetitions or band resistance should increase over 6 weeks. The first exercise starts facing the wall, in a lunge position with your bottom and chin tucked in and tummy muscles tense so that your trunk stays still as you move your arms. Place the little finger side of your forearms on the foam roller and push it against the wall as you slowly roll it up the wall as far as you can. Keep your chin tucked in as you do this. Repeat 10 times. This exercise will also help you to move your arms above your head. The next exercise works the pecs. Pec muscles exercises are particularly important for women having implant-based reconstructions. Start by anchoring an elastic resistance band above your head. Over the top of a door is ideal. Stand with your back to the door with your arms as high as possible above your head, holding onto the band so that it is on stretch. Slowly pull your arms down and then slowly let them return to the starting position. Keep your trunk still by tensing your tummy muscles like you did in exercise 1 and make sure that the band always has tension in it. The next exercise focuses on the lat dorsi muscles, which are located on the upper back and help move your shoulder. Lats muscle exercises are particularly important for women having lat dorsi flap tissue-based reconstructions. Anchor the band above your head. Face the door with your arms as high as possible above your head, holding onto the band so that it's on stretch. Slowly pull your arms down and then slowly return, keeping your trunk still by tensing your tummy muscles. Do not let the band go slack at any point. This exercise will help you to do pushing activities with your arms, such as getting out of bed or a chair and raise your arm above your head. Now, to strengthen the rhomboids, the muscles between your shoulder blades which are important for good posture. Anchor the band in the side of a closed door and level with your trunk. Face the door holding onto the band with both hands so that it's on stretch and your elbows are level with your shoulders. Slowly move your arms forwards and backwards in a rowing motion, keeping your trunk still by tensing your tummy muscles. Keep tension in the band at all times. Muscle stretching exercises should be held in the position for at least 15 to 30 seconds. Repeat each stretch 10 times. During the stretching exercises, your muscles should feel stretched. Mild discomfort is okay, but not pain. Your range of movement should increase by a small amount over 6 weeks, though progress will be slower after radiotherapy. Stretch exercise 1. Pecs. Start by standing upright with your tummy tense, your shoulder blades together, feet in a lunge position, and your forearm in contact with the frame of a doorway. Lean forward until you feel a stretch across the front of the chest. Hold this stretch. This movement will increase flexibility of the pectoral muscles and help you to raise your arm above your head. For the next exercise, stand in a lunge position with your tummy tense and your shoulder blades together, holding the resistance band in your hands behind your back so that they're as close together as possible. Keep your trunk still and move your hands downwards towards your feet and then backwards, away from your body, until you feel a stretch across the front of the chest. Hold this stretch. This movement will help you bring your arm up your back, as in doing up your bra. Now we move to the floor. Start by bending your arms, reaching out in front of you so that your lower back is curved. Reach out with your hands until you feel a stretch around the back of your armpit and down your back. Hold this stretch. This stretch will help you to raise your arm above your head. The next exercise stretches muscles in the armpit region of your trunk that move your shoulder blade. To stretch the muscle on your left side, stand upright in a corner with your hands level with your shoulders and your fingers facing inward. Bring your shoulder blades together like a soldier. Step your left foot across your right foot and turn your body to the right as far as possible, keeping your shoulder blades together. Hold this position and move your hips towards the wall so that you feel a stretch in your left armpit. The stretch in your armpit should feel mild discomfort, not pain. Do not lean too much on your left shoulder. Repeat on your right side. This exercise will help you to bring your arm above your head and turn your trunk. The next two exercises are optional. They can be done in addition to the previous exercises. For this pec strengthening exercise, anchor the resistance band at trunk height, jammed in the side of a closed door. Stand with your back to the door and your feet in a lunge position. Hold on to the band so that it already has some stretch, with your arms far apart so that you feel a stretch across the front of your chest muscles. Keep your trunk still and tummy tense as you slowly pull your hands together and then slowly let them return. The band must always have tension in it. Repeat 10 to 15 times. For the optional lat strengthening exercise, stand in a lunge position with your tummy muscles tense and your arms as high as possible above your head. Hold the elastic band between your hands, ensuring it is on stretch. Slowly pull your hands apart and then slowly let them return. Do not let the band go slack at any point. Repeat 10 to 15 times. Remember to contact your breast care nurse if you're unable to do the exercises cause your pain or they affect your scars. Taking photos of yourself at the start of the exercise program is a good way to track your progress. If you're concerned that you're not improving, talk to your breast care nurse. You might be referred to a physiotherapist or exercise physiologist. And remember, if you have an expander under your pectoral muscle or if you have skin changes after radiotherapy, improvements on your strength and flexibility will take longer. Always ask your surgeon if and when you can start exercises demonstrated in this video after your surgery.